Hello. Our next topic of discussion is cubital fossa. The headings we are going to discuss in this video would be what is cubital fossa, boundaries of cubital fossa, contents of cubital fossa, and the last would be clinical importance of cubital fossa. So, let's start with what is cubital fossa. Cubital fossa refers to depression on the anterior aspect of the most distal part of the humerus, or we can say the elbow joint. Depression on the anterior aspect of the most distal part of the humerus or the elbow joint. Now, we will talk about the boundaries of cubital fossa. Boundaries, there are three boundaries: superior, lateral and medial, and a floor and a roof. Superior, medial and lateral. The superior boundary is first, we will discuss superior boundary. The superior boundary is formed by an imaginary line between the two epicondyles of humerus, between the medial and the lateral epicondyle of humerus. Imaginary line that connect with these two forms the superior boundary of the cubital fossa. Next is the medial epicondyle. The medial boundary of the cubital fossa is formed by the mass of the flexor muscles of the forearm. We remember that the flexor muscle of the forearm arise from the medial epicondyle of humerus, so they form the medial boundary of the cubital fossa, and the major muscle involved is Pronator Teres. Yes. The next one is the lateral boundary. Similarly, as the flexor muscle of the forearm form the medial boundary of the cubital fossa, the lateral boundary of the cubital fossa is formed by the mass of the extensor muscles of the forearm. We take its origin from the lateral epicondyle, and the major muscle that is involved is the Brachioradialis. Now, talking about the floor and the roof of the cubital fossa. The floor is formed by the Brachialis muscles of the forearm, and the second muscle involved is the supinator muscle of the forearm. Brachialis muscle of the arm and supinator muscle of the forearm. The roof of the cubital fossa is formed by the deep fascia of brachialis, bicipital aponeurosis, and the skin and the subcut tissue that separates the above the bicipital aponeurosis. Now, talking about the contents of the cubital fossa. The contents of the cubital fossa include, we usually use the mnemonic MBBR from the medial to the lateral side. For M stands for median nerve, B stands for the brachial artery. Next, B stands for bicep brachii tendon, and R stands for radial nerve. The brachial artery also gives origin to various terminal branches within the cubital fossa. Similarly, the radial nerve also divides into superficial and deep branches within the cubital fossa. Now, talking about the clinical importance of cubital fossa. Why is cubital fossa important? Because of venipuncture. Venipuncture in cubital fossa is important. Why? Because it is the major site in the human body of venipuncture and involves median cubital vein, which is the major vessels involved in major sample taking site in the human body, and also for injecting drugs in the human body, both for injecting drugs and taking blood samples from the human body. Next, it is bicipital aponeurosis. What is the importance of bicipital aponeurosis? Bicipital aponeurosis is important because it separates median cubital vein from median nerve and the brachial artery. Now, next, third point is coronary angiography, coronary catheterization, or we can say cardiac catheterization. It is done in patients with renal failure. Again, the vessel involved in cardiac catheterization is the median cubital vein. Now, the last is coronary angiography. Coronary angiography can also be done from the cubital fossa, and here the major vessel involved is the brachial artery. Now, here we can say the complete anatomy or the summary of the whole video. Then we have the contents. From the medial to the lateral side, we have first the median nerve, then the brachial artery, then the bicep brachii tendon, and the last one involved is the radial nerve. Similarly, on the medial side, you can see there is the Pronator Teres muscle that forms the medial boundary of the cubital fossa, and on the lateral side there is the Brachioradialis which form the lateral boundary of the cubital fossa. We can also see the ulnar and the radial artery, as we have previously discussed that brachial artery gives origin to its terminal branches in the cubital fossa, which are the ulnar and the radial artery. That's all from cubital fossa.